Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Anwar Zaytoun. He's an interventional cardiologist with Covenant Cardiology. Thank you so much for being here. How are you?
It's my pleasure. Thank you, Colette. I'm doing well. About yourself?
I'm doing well. Thank you, doctor. So today we are talking about peripheral artery disease awareness. To get us started, September is Peripheral Artery Disease Awareness Month, or PAD month. So what is PAD, doctor?
PAD is as you said, medical term for peripheral arterial disease, and simply it means problem with circulation. It's very common. It affects up to 20 million Americans, and it's basically a problem with the blood flow through the arteries, which are the vessels that take the blood away from the heart to the rest of the body. And it's more common to see peripheral arterial disease in the legs, even though we see it sometimes in the arms. And it's associated with many risk factors: high blood pressure, diabetes, and smoking. So I'm happy that we have this opportunity to talk about peripheral arterial disease, or PAD, in this, because we have many patients that are not aware of the symptoms or the consequences of not getting treated for this problem.
Yeah, doctor, so for viewers out there who say, oh, this might be my issue, what are the signs and symptoms that people should watch out for?
The major symptoms of peripheral arterial disease are fatigue in the lower extremities with walking. Some people might get actually burning sensation or muscle fatigue after walking half a block. That was not there before. Other patients might present with small wound on the shin or the foot that has not been healing well despite treating it appropriately with medications and seeing doctors. And in rare cases, we have seen actually the major complications of peripheral arterial amputation because of non-healing wound and infection that can extend in some cases to the bone, causing what's known as osteomyelitis. So there are many symptoms that and signs that can actually be seen in peripheral arterial disease.
Yeah, so why is it so important for people to know about PAD, doctor?
Well, it's very important to know about it because it's, number one, preventable by simple tests that we do in our offices. We check the blood flow, we measure the blood flow in the arms and in the legs, and we compare it. And that will tell us, give us a very good idea if there is a peripheral arterial disease or not. And whenever we see patients with peripheral arterial disease, that will increase the risk of having cardiac disease or even stroke down the road, because if you have a blockages in the vessels that go to the leg, you might have similar problem in the heart or in the neck vessel, mainly corroded disease, that can cause stroke down the road. So it's preventable with simple tests. It's manageable with medications to prevent major complications down the road. That's why we should educate our community about it.
Sure, so definitely you need to know these signs and symptoms and get diagnosed and treated. Tell us a little bit more what people, if they're a little fearful of this, what they should know about diagnosis and treatment, doctor.
Well, diagnosis can be made based on patient's symptoms, patient's risk factors. As you know, having long-standing history of hypertension, diabetes, and smokers specifically are at high risk of having this problem. Once they have, or they feel they have sometimes this weakness or fatigue in their legs with walking, and that was something new to them, it would be better to assess that through their family doctor or through primary care physician. The test that we use for diagnosis of this problem is a simple test. It's called ABI, and it does again measure the pressure to the legs and compare it to the pressure in the arms. And if the pressure is decreased, it tells us there is a problem in the blood flow to the legs. So this would be the very first test that we use. It's very simple. It takes 10 minutes, and it can be done at any doctor's office that have vascular lab. And it's very informative test. And based on that, we start medical therapy with the blood thinners like aspirin, cholesterol pills, and sometimes if patients have uncontrolled hypertension, we try to help them with that too. And then if they kept having symptoms, or if we find something that needs to be acted on immediately, like an ulcer or wound, then we do CT scan or sometimes peripheral angiograms, take pictures of the blood vessels and see if we can fix the problem.
I love that. Just simple tests to find out that if you have this or not. Doctor, are there things that people can do really to prevent or manage PAD?
Sure, absolutely. Prevention is key in patients who have the risk factors. The best thing patients can do is to walk regularly, at least for 20 to 30 minutes, at least 3 to 4 times a week. That will help improve the blood flow to the lower extremities, even if they have peripheral disease. Exercise is key in treating these patients, actually, even after starting medical therapy and going for intervention. We encourage all our patients to walk on a regular basis to improve the blood flow. They have to treat the other medical problems that can worsen the peripheral disease or PAD, like diabetes, high blood pressure, and if they are a smoker, I do really encourage them to stop smoking because smoking can have major consequences in patients with peripheral disease, because we know that they have similar problem probably in the heart or in the neck vessels, and the problem with that is you might have more problems than blocked artery in the leg. It could be a stroke or heart attack.
Right. And Doctor, I can tell you're very passionate about this topic. Why are you so passionate about educating people about PAD?
Because it's preventable disease. I know many people that they did not know about this disease, and the only time they heard about it when they came to the hospital with the ulcer or a wound. And I know that there's a lot of things could be done to prevent the patient who has peripheral disease from getting to this stage. I felt there's a lot of room to educate our community about it, and this is why I ask all my patients when they come to the office about any symptoms of leg pain, leg weakness, fatigue when they walk, and that would be very simple. This is a very simple question that can tell us a lot about big problem hiding there. So that's why I feel like every time I see one of my patients, I have to screen for it and make sure they don't have it, because it's there when they have heart disease too.
I just love how you're letting everyone know that education definitely is key, and PAD is preventable, and it's also manageable. Thank you so much for bringing us this valuable information, Doctor.
Thank you very much, Liz. It's a pleasure. Thank you.
My pleasure. Of course. You are delighted. Anytime you want to come back and educate us some more, we would appreciate it, Doctor. If you would like any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.